Welcome back, my friends. As you probably know, October is Breast Cancer Awareness Month. Most women know the importance of having annual mammograms starting at the age of 40, but did you know that you should start those mammograms at a younger age if you're considered to have high risk of developing breast cancer? Dr. Tanya Martin Dunlap, breast surgeon at the St. Luke's Women's Center, is here to help women determine if they may even be considered high risk, because just the thought in the back of your mind can be alarming enough. Thank you very much for being here.
Yeah, thanks for having me.
So first of all, let's do some definitions here. What does it mean to a woman if she is higher risk for breast cancer?
So we're used to talking about in October, women have a 1 in 8% or 1 in 8 chance of getting breast cancer, which translates to 12% for the average woman.
Okay.
So when somebody's greater than 20% risk of breast cancer over their lifetime, then we categorize them as high risk.
How would a woman know then if she is at an increased threat level for breast cancer?
Okay, so there are some special calculators that have been developed that will help us calculate a woman's personal risk of breast cancer. And so these consider things like her family history. So breast cancers, ovarian cancers, other cancers in the family on either side of the family. Her estrogen history, so how old she was for her first period, how old she was when she had her first child, or some personal history. So if she's ever had breast biopsies before, even if they're benign, those all get put into these risk calculators, and then we can decide if she's elevated risk and we need to do things differently, or if we need to consider genetic testing.
I assume that these risk calculators are based on volumes and volumes and volumes of historic data, among other things, probably.
And all standardized and tested, and they're used across the practice, across the industry.
So let's say that a woman has, probably through the help of a health professional, has discovered that she is at an increased risk. Is the screening process different for her? Does it start earlier? Is it more frequent? How does that work?
Yeah, so a little bit of both. So we know all women should start getting mammograms once a year at the age of 40. So if somebody comes into the office and we find out, or we already know that she's at a high risk, we may start mammograms at a younger age. We may add in different imaging. So we may also do a breast MRI or a breast ultrasound every year to add to the mammogram so that we can look at the breast tissue in a different way. And then also they need to get more frequent exams, so see their doctor more often for exams. And these are just ways to help us sort of take a closer look and pay closer attention so that if they develop breast cancer, we find it earlier rather than later.
And what is the best way for someone who's watching right now to determine if she has an increased risk?
Okay, so for women who are already at mammogram age, already 40, if they go to St. Luke's for their mammogram, they're going to get a tablet when they check in that has these calculators built in. So they'll enter all their information, and then we'll be able to calculate their risk then.
Very good. Okay.
If they're not yet old enough for mammograms, which is sort of the key demographic that we want to reach.
That's what you're targeting, yeah.
Then they can either talk to their primary doctor or their GYN, and they can discuss their risk factors. And if they're not comfortable doing the calculations for them, send them over to the breast clinic for a high-risk assessment, and then we can calculate their risk and direct them from there on what they need to do.
This shouldn't be a point of anxiety for you. We just want you to be prepared and be proactive about it. Thank you, Doctor, very much.
You're welcome. Thank you.
If you would like to know more about your personal breast cancer risk, or you need to schedule a mammogram, just visit stlukesstl.com or call 314-205-6491.
All right, good discussion. Thank you, Matthew.